Good afternoon. I am Michelle O'Connor, and I am the owner of O'Connor Insurance Associates located in Charlotte, North Carolina. We are an independent insurance agency for those of you who don't know me. I have spent a considerable number of years in the insurance business and owned my agency for the last 20 years. We just celebrated 20 years in January. My husband and I own the agency together, and yes, we are both working from home right now. He's actually got an office in the basement, and the kids and I, and yes, I did say kids because all three of us are in a 10 by 12 office space upstairs. Never fear, they and the dog have been banished upstairs, so hopefully there will be no interruptions of barks or cries for lunch during our webinar today. So just wanted to go ahead and kick us off. This is the second of our two-part series. I am super excited to have with me today Kim Baker, who is both a friend of mine and has been a consultant for O'Connor Insurance for a number of years. Kim has helped us from everything from recruiting to isolated employee challenges, being able to consult with her on specific incidents that have occurred, hiring, onboarding, even when folks have left us on good grounds, making sure that we've got everything squared away and straight. And Kim has also consulted with me already on a few of these COVID questions that have come up. And I know they're going to come up for you too. So I thought, why not share all this wonderful information with you so that you can have the same good stuff in preparing your agency. So a couple of things I wanted to share with you as we get started. The format of the presentation. So for about 25 minutes, we'll do a Q&A, and we do have the questions already prepared. But with that being said, you do have a chat box. If you have a question, just go ahead and put it in there whenever you think of it so you don't forget. Just so everyone knows, the whole audience doesn't see those questions. They just come to me, and then we'll be able to read them out loud so I can ask Kim the information live while we're all here together. So don't hesitate to put your question in there. Don't be embarrassed. This is only insurance agents on the call as well. So it's all in relationship to insurance and what we as owners are dealing with every day. So don't worry about anything like that. Let's see what else. Before we get started, my favorite thing, I have a poll to share with everyone. So I'm going to launch that real quick. And I want to know if you've already had any HR issues that have already arose from this COVID crisis. If you've had a question, or maybe you had a team member that you thought was exposed. So if you'll just take a quick second, look at the poll and go ahead and give me an answer. Awesome. Well, I'm seeing a lot of no's. That is super exciting. So I'm going to go ahead and close the poll in a few here. 3, 2, 1. And I'm going to share it with everyone. There we go. So I'm glad to hear that there have not been a lot of folks that have had HR issues. So hopefully this information will be preventative for you. For the other person that said that they did have an issue, we in fact had a question as well. And so we're in the same boat, and I like to be prepared. So that's the other reason why I wanted to share all of this exciting information with you all. So I am going to go ahead and kick us off without further ado. So let me introduce Ms. Kim Baker to everyone. And I need to stop sharing my screen so that you can see her. There we go. Okay, Ms. Kim, would you like to introduce yourself?
Sure. My name is Kim Baker. I am the owner of Baker HR Services, and I'm an HR consultant. We provide HR to companies that don't have enough HR or don't have any HR at all, and we provide it on an as-needed basis. And we're here in Concord, North Carolina, and we have been involved in HR for more than 20 years. Happy to be on today and honored to be with Michelle and O'Connor Insurance and helping you guys get through this difficult time.
Great, thanks so much, Kim, I appreciate it. I did want to share with everybody that after the presentation, I will be recording this and sharing it, and then I'll also provide the PowerPoint screen. So if there's anything that you miss when you're listening, don't hesitate to just wait for those to come out. I'll have those out by the end of the day today, so you'll have everything in your hands. The first presentation that I did last week is already posted on YouTube as well. So I'll share that information with you too in case you'd like to go back and listen to that. We do have a couple of follow-up questions at the end that I'll be sharing. So I'm going to kick off by asking Kim the very first question. And this is probably all on our minds as we're thinking about getting our agencies back together and back to work. What if someone is afraid to come back to our office? What's a good way to handle that?
So there's 6 things you want to consider that I share with my clients regarding this particular situation. First, you want to make sure you find out why. Some people will say they're scared and they don't really explain why. It's very important that you delve into the root cause of that to determine if they have a protected COVID-19 reason. Maybe they're saying they're just scared, but maybe they think that they've been exposed. Maybe they think that they have it. Maybe they're caring for someone who thinks that they have been exposed or has it. So it's very important to make sure you ask a lot of questions to get to the bottom of the issue. Also, you want to consider, number 2, share with the team and educate your team on the symptoms. You really should be surveying all your people to make sure they are symptom-free before they return to your office. And number 3, having a detailed protocols in place for safety. You want to share that with your team so they can feel more comfortable. Maybe they just don't know all the best practices and all the research you've gone through to make sure that everyone has a safe return. So having a detailed process for that, sharing that with your team will help calm their fears, possibly. And then consider, is there a particular reason that they are concerned? Is there a particular area maybe that you haven't thought about, that you haven't fully mitigated as an employer? So certainly explore that as well with them. And number 5, you want to consider creative ways and options to accommodate them if they're fearful. Can they work remotely? Can you isolate them from customers and so they have less interaction? During this time of COVID-19, when you look at the regulations and the questions and the answers that come out, they talk a lot about being flexible. So you want to make sure you think outside the box. But finally, you're not required to pay this person. If they are fearful for not a COVID reason, you're not required to pay them, and they're not eligible for unemployment. However, you can be more generous, and we are talking to our clients about, this is a fearful time and everyone's different in their comfort level. So you want to consider, do you want to give them unpaid leave of absence? Do they have available PTO that they could use? Would you be willing to let them borrow against future PTO? But one thing you have to keep mindful is that whatever you do for this one person, you'll likely need to do for anyone on your staff that may request it. So you need to think that through and what you can handle and what you can't handle, so nobody will come back later and say, you let Joe do this and I'm Sue and you didn't do it for me, and that's discriminatory.
Well, those are some excellent points, Kim, and a lot of really good information. So follow-up question to that is, what if I think that someone is at risk, how do we handle that? If we think they should be staying home because perhaps they've been exposed or they've indicated to us that they might have been exposed.
Right. So if someone truly has been exposed or thinks they have been exposed, then certainly they should be staying home. They should be self-quarantined, and this should be a part of your safety protocols. They should be quarantined for up to 14 days to make sure you should be directing them to seek medical advice. But if you just believe because of what you can see, maybe they're older, maybe they're pregnant, maybe you just perceive that they're at risk, you really have to have a medical professional opinion to determine that. And it really is up to the employee to determine and work with their physician on whether or not they should stay home. You can't make them stay home. We've seen that with other clients, is that they say, you're pregnant, everyone who's pregnant, you're not working. Well, that's really discriminatory and really waiting for a suit to happen. Number 2, you can't inquire about underlying conditions. If someone says, I'm at risk because of an underlying condition, they are not required to disclose that information. You really don't need that information to make a decision to say, okay, stay home. You can ask for the doctor to certify that. And number 3, You also want to share with your team as a whole, maybe not just single this person out if they're reluctant to stay home. Here's the protocols in place and the support system we have in place. Here's our sick policy. Here's the act that's in place to help protect you and provide you financial security should you need to stay home for a valid COVID-19 reason.
Well, that's certainly a lot to think about as well, and to remember through going through all of this. I think there's going to be a lot of challenging situations that will face each of us, and they'll all be a little bit unique. So great suggestions as well. So moving right along, how do I prevent being sued from either employees or customers saying that they got COVID from my agency?
Sure. So I'm not an attorney, nor do I play one on TV, but this is, we'll share my best practices and through my research, because it certainly is a concern for all of our clients as well. So, attorneys are saying that you need to, you'll be judged by a jury should you be sued on did you take reasonable accommodations, did you follow the protocol? So it's very important as an employer that you stay on top of the CDC recommendations, the OSHA recommendations, the reopening recommendations, your industry specific recommendations on how to protect your employees and your clients. And so it's very important you follow that. You have a written plan that tells you how you're going to respond to different situations. If someone comes to you and says, I think I have COVID-19, or if someone comes to you and says, I think I've been exposed, what are the protocols that you can swiftly put in place and do that? In addition to that, you just need to make sure that you're also reminding your employees to follow that. Everybody's different in how exposed they feel they are. So make sure that you're reminding them on a regular basis what you need to do. You can take temperatures of your employees before they ever enter the office. You can, but again, taking someone's temperature doesn't actually, not all COVID-19 cases have actually resulted in having a temperature, but it would indicate that they are possibly sick, and you would want that person to stay home, and that should be in your protocols as well. Even if you don't think they have COVID-19, it's highly recommended that they stay home and be symptom-free for 48 hours before returning to work. If it's a COVID-19, probably 14 days. But again, look at the latest recommendations. It's a fluid situation. New recommendations and protocols are coming out all the time. But make sure you have those protocols in place. Everyone knows what they are. Have a person in your office that is responsible for staying on top of, the latest and greatest recommendations. As you know, with COVID-19 and reopening, not everybody has, definitive dates of returning, especially your clients and different things. So it's very important that you stay on top of that.
Excellent feedback. It is a very fluid situation, and it is a lot to keep up with to make sure that you know what all the protocols are and recommendations are. But I know for us, the fact that we've been asking actually since January if anyone is sick to stay home, because we had just a rash of colds and flu, just normal wintertime bugs that had come through the office in our families. And so we had already started asking that, please stay home if you're sick, please stay home. We'll make work accommodations if you'd like to continue to work, but if you don't feel well, don't infect the rest of us.
Right.
So now we're going to move into a topic, and I'm going to actually share my screen for a second. The Families First Coronavirus Response Act and Employer Paid Leave Requirements. It's a mouthful. So when this first came out, it was the end of March. I know in my agency, we were kind of in panic mode as to getting things changed out, talking to clients, trying to help people. And so I read a lot about it, and then I kind of put it on the shelf. But I think it's really important that we all pull it back out and analyze it and truly make sure we understand what our requirements are, particularly as small businesses. So Kim has prepared some great screens for us that I am going to share. Go. Okay, Miss Kim, take it away.
All Right. So, first of all, there are notice requirements. So, you should have received or seen, and I can certainly share this with Michelle to share with you as well, a poster that you need to notify your employees with. If your employees are remote, it's a good idea to email it rather than just post it in your office and no one's there, right? You're required to get it to them and answer their questions. This was effective April 1st. And it is for employers who have less than 500 employees. And this was put together very quickly to meet the need of employers and employees who may be absent or may have challenging situations. And so again, it's a fluid situation. Since it has come out, there has been more than 90 frequently asked questions that have been posted out there. Clarifying these acts. So it's very important, should a situation come up, that you consult with a HR professional and an attorney to make sure that you have the latest information and are complying the best you can. So there's two parts to it. There is the emergency family medical leave expansion part of it, and then there's a sick leave part of it. So first we're going to talk about the emergency family and medical leave expansion. It's effective through the end of the year. It'll automatically expire, and who is eligible are employees who are unable to work or telework due to the need of care for a son or daughter under 18 years old, if in school or a place of care is closed, or the child care provider is no longer available due to a public health emergency. So employees who are eligible have to be with your company at least 30 calendar days. There are some exclusions. There is an exclusion for small businesses with less than 50 employees if their business is in jeopardy. So there has not been a lot of clarification on how to get this exemption, where to submit it, how to document it. So it is risky in itself to ask for that. So you want to make sure you consider that carefully before you do that. Is it paid? Yes, the first 10 days can be unpaid, and then you can use PTO for those first 10 days. The remainder of leave must be 2/3 of the employee's regular pay, and then there's limits to it that you'll see here, up to $200 per day and $10,000. They can get leave up to 12 weeks, job protected leave. So this means someone's out and you need someone to fill in, you should have a temporary worker, because every expectation is they will come back and you will need to put them in the same job at the same pay or a similar job at the same pay. So that's the first part of it. On to the next slide for the second one. The second one is the emergency paid sick leave. Again, it's for the same number of employees, the same time period, but there's 6 different reasons that an employee can do this. Local quarantine or isolation order, healthcare provider advises that they should self-quarantine, they're experiencing symptoms and seeking diagnosis, they're caring for an individual subject to quarantine, or the child care whose school or child care is closed, or in experiencing a similar condition such as an emergency like COVID-19. So the eligibility is here, there's no restriction. So if you have a person work one day, they could take this leave. Is it paid? Yes, based on the employee's regular compensation, but capped at a maximum of 100% wages up to $511 per day. And then there's a total cap as well, and that's for reasons 1 through 3. So that's the local quarantine, the healthcare provider advises that you should self-quarantine, or you're seeking diagnosis because you think you have symptoms. And then you can pay them 2/3 of wages up to $200 per day, up to a $2,000 max, reasons 4 through 6, which is caring for someone else subject to quarantine, or care for a child whose school or child care is closed. And how much leave is available? It's up to 80 hours of paid sick leave for a full time. And then the part-time would be the average hours worked over a 2-week period. Again, it's a perfect storm of compliance that was well-meaning to try and help out employees that may be in difficult situations, but even if these things possibly don't comply, you still have to think, do they qualify Americans for Disabilities Act? Do they qualify for FMLA? So certainly want to consult a professional.
Thanks, Kim. That's a lot of information to digest. And I know that if the situation arises, you definitely need to consult with someone. There's no way I'd be comfortable navigating that if that situation came up. There is one piece of that I want to make sure that you consult with your accountant about. There is some payroll tax credit that is available to small businesses if you have to implement this for an employee. And I would definitely advise you to speak with your accountant to make sure you understood how to properly do that. But when I first read it, I really panicked because it would place a big hardship on our agency. We're small, and having one of our team members out and having to pay them would be a very difficult thing for us to do. So I wanted to make sure that I thoroughly understood everything and that tax credit. There is a very small blurb about it in the law, and that's why I think the accountant would be instrumental to bring it as well.
Sure, and we also recommend that we have template letters as far as collecting information when someone requests this, so that you can gather all the information that you can give to your accountant to be able to qualify for the leave. One thing that's a little scary that I heard yesterday from one of my payroll counterparts is that if you're on the PPP, you may not be able to get both. So you need to check with your accountant as well. If you're getting assistance through the PPP, it could impact your ability to get these tax credits.
Wow, it's a whole ball of wax, and this is such uncharted territories that I think bringing all your professionals in for guidance and documentation are going to be the two key things that you'll want to remember. If those would be the perfect takeaways from this situation.
Absolutely.
So Kim, one thing that really concerns me, and I've read a lot about this, is the privacy portion of this. Especially, we are a small shop. We have less than 10 in our office. If someone tests positive or has to be quarantined because of their exposure, what are we allowed to share with the rest of our staff?
I've looked into this as well because it's a real concern. I mean, because it's an emergency situation, they are allowing you, in some cases, do a little bit more than you normally would be able to do from a privacy perspective. However, it varies from state to state. So you certainly, again, want to talk to your attorney in your state on what to do. But according to the local attorneys that I am speaking with, you need to, if someone tests positive, you need to report to customers that could potentially be impacted and your team that there has been some exposure. In North Carolina, my understanding is from this attorney is that you cannot tell anyone that it was a particular person unless they have given you permission. In addition, also, even taking temperatures and all the things that you're allowed to do, you need to keep that very private and only on a need-to-know basis.
Well, that's really good insight. I think that's a big concern for me. And I'm glad to hear that they can give us permission, because some of my teammates would likely just say, please tell everyone that it was me and make sure that we keep everybody safe. So that's great insight. Kim, I can't thank you enough for being on with us today and answering these questions. This is so much information for all of us small business owners to take in and try to understand that without a professional like you in our corner, I don't know how we navigate this stuff.
Absolutely. I'm so glad to be a part of it. And if anyone needs my help, I'm happy to. You can reach out to us via our website, www.bakerhrservices.com. It has all our contact information there. Happy to answer some simple questions and help you get through these difficult times.
I do have one question to answer from the chat. Do you have a sample agency policy and procedures COVID document that you can share with the group for us to customize for our own use? Have you done anything like that in a template format?
So are you talking about the safety protocols or what in particular?
The question says a sample agency policy and procedure.
Yeah. So we have some good best practices that we are putting together and some Q&A, so we can certainly get that out this week.
Excellent. And if you go to Kim's website, she has some great blog articles too that have answered quite a few of my questions and things that had just been kind of floating around in my head. How do I address this? What am I going to do with that? She's laid out quite a bit of really great information on there as well. So I'd encourage you to check out her blog as well. Kim, do you mind repeating your website one more time?
Right, it's www.bakerhrservices.com, and my email's kim@bakerhrservices.com as well.
Thank you so much. I appreciate that. And I will share that as part of the presentation as well, so everybody has it and can just directly link to it. So I've got two quick questions that I got after the presentation last time. So I am going to share my screen with you one more time. Kim mentioned this, but so it's a perfect lead in. I had got the question how we were handling visitors coming to the agency if we were open for the public yet. So again, I want to do a quick poll and ask, whoops, this is our one that's already in progress. Sorry about that. There we go. And ask if you are open to the public right now. So when do you plan to open? If you're already open, when it goes into phase 2, or if you're just plain not sure at this time because this is such uncharted territory. Awesome. Looks like everybody's answered. So I am going to end the poll and share the results as well so everyone can see. It looks like it's a pretty good mix-up. Some people are already open to the public. I know a lot of folks are looking at phase 2 and what those guidelines mean and looking at reopening to the public at that time. And then there's quite a few that are not sure as well because it's such a fluid situation. So I am going to share with you what we put together. So right now we are closed to the public. That was the choice that we've made. We are an electronic based agency, so there's almost nothing we can't do for a client electronically to service them. So there wasn't a need for us to open to the public to service our clients. We have had the need to have a few vendors in our agency, but only on an absolute necessary basis. So I kind of deem them as essential vendors. We've got our HVAC folks coming this week because we have turned on our air conditioning and need to do that. So we've got them coming, and I've already checked with them with their protocols. But I also thought it would be great to post this on my door because our door is locked. So when somebody calls to come in for the appointment, that it's right in front of them. And then I'm also going to share it with our shred vendor who will undoubtedly be back into our office at some point soon. So we put guidelines in place for our team and guidelines in place for vendors that are coming from the outside. This is the vendors from the outside. Obviously reminding them if they're not feeling well to stay home and reschedule the appointment. To wear a mask at all times. If they don't have one, I've got a basket right beside the door with gloves and disposable masks in it, which takes me to point 2. We're asking everyone to wash their hands when they enter our office. And if they'd like to wear gloves, at that point, they can put on a fresh set. We've already had a vendor that came in with his gloves already on, which sounds great, but I'm not sure how many places prior to us he wore them. So I'd like to make sure that we start off with fresh gloves and fresh hands at my location. And I'm happy to provide those items to folks. And then also just reminding them to follow social distancing protocol when they're in our office and staying 6 feet away from my staff at all times. And I do have 2 staff members that have returned to work from the office. And then last but not least, if they do need to enter one of my team members' offices, to give them the opportunity to exit the office first so that they aren't in there at the same time as them. So here are the procedures, and Kim teed this up nicely for us, but we put this into practice in our agency already. I also sent this to my employees via DocuSign and asked them to sign it just so that they knew how serious I was about this process. I don't typically do that, but I really felt strongly that I wanted everyone to feel comfortable that we've covered our bases and that we're going to enforce these things as well. So these things are nothing that you haven't heard. It's the typical things. If you've got a fever, stay home. If you're sick, stay home. Wash your hands when you enter the office. I'm reminding my staff to wash their hands if they touch their faces or if they eat their lunch or they sneeze. You know, lots of extra hand washing. I've asked all of our staff to wear masks in all of our common areas, and most of them already had reusable masks they were planning on wearing, but I also have provided disposable ones in case they come in and forget. I've also provided the guidelines for how those masks need to be cleaned, because it's very important that they be cleaned properly and handled properly to make sure that your teammate doesn't inadvertently infect themselves by use of wearing the mask. So that would be terrible. We also have a few common appliances, not a lot. We have a very small little kitchenette area. So I've just asked our teammates if they use one of our common appliances to go ahead and use a disinfectant wipe on it immediately so it's fresh for the next person. And then also to be sanitary at their own desks, just doing whatever additional wiping they would like to do to keep it clean on all of their peripherals. Not to use any other team member's desk or computer space. We've even gone so far as to say that we have shared equipment in one member's office, and we don't want anyone else to use that shared equipment. So if they need to use it, they need a scan done, they can put it in a folder and hand it to her or leave it in the common space for her to pick up. Then we also had some stay healthy guidelines. That's just a little card that I asked them each to print and leave at their desks. I'm happy to share that. I shared that after the first presentation. Just, it's our quick little, wear a mask, cover your mouth, all those good little things too. Just constant reminders to keep everybody healthy. These are the same guest procedures that I already mentioned, but I gave these to my staff in our protocol as well. I also want to point out that I assigned one of my 2 team members that's at the office right now as the enforcer of these. One of my team members is my greeter, and by nature, she is very warm and friendly and inviting and will gladly welcome anyone into our office, which is just the person that I love having at my front desk. But during this time, I need somebody that can also enforce these rules. So if a vendor comes and they don't have the compliance or don't want to comply with what we've asked them to do, that they need to call me and reschedule the appointment. They're not welcome in the office. So I think it's really important that you think about who's strong enough to be able to say, hey, who's going to make sure that these guidelines are followed in your office, or it doesn't really do us much good to put them into place.
Absolutely.
Last but not least, I had this checklist last week, and I've added just a couple of things to it, and I was asked for it again, so I thought it was worth sharing. Nothing that you probably haven't already seen. Of course, the big challenge right now is getting the supplies. So I am still challenged by getting disinfectant spray and wipes. We have a stock supply that is dwindling, but we do still have some. So I'm hopeful that by the time we completely run out, we will have additional ones. The other items on there, I think I've mentioned already. If there's anything on there, or if you have any ideas for adding to it, I would certainly love to hear what you have to say and love to hear any feedback that you might have about that as well. So I'm gonna go ahead and stop sharing my screen so I can announce that we are going to have another webinar, excuse me, it's allergies, not any kind of other issues. The allergies are killing us in North Carolina right now. Excuse me. Next week, we are going to have a guest who is an attorney in town. Her name is Kelly Rains Jessens, and she is a partner at a law firm. And she is going to answer a couple of these questions that we just talked about. One is what happens and what's the protocol for if someone claims that they got COVID at your agency, or if you feel like you potentially could be sued. She has been dealing with a number of scenarios and a number of different types of businesses and is a wealth of knowledge. She's already shared with me a great deal of it. And I know she'll be a wonderful guest to have and give us a wealth of information. So I hope you will join us next Wednesday. There is a time change because Kelly had a conflict at noon. So the webinar will be at 1 o'clock. We will be recording it to share afterwards as well. I feel like this information is so important that there's a good chance that you'll want to go back and listen again. So just like today, Kim said several things that I wasn't fast enough to write down. So I'll be listening to it again to make sure that I can develop out a couple of the really important things that I noted that I don't have prepared that I'd like to have prepared. So if there are not any other further questions, let me double check our questions. I don't see any, but please reach out to myself or to Kim if you have any additional questions. We'd love to hear from you and help you navigate this. And I mentioned Kim has provided a number of services to our agency, but I did want to plug her for just a second and tell you that she is wonderful at what she does. She has helped us recruiting just immensely. You know how challenging the job market has been prior to this. And we are fortunate to be in a metropolitan area, but because of that, when we post for an opening position, we get inundated. And so without Kim's help, I'd still be sorting through resumes right now, never having gone to the hiring phase. She's also just recently helped us update our employee handbook. which was excellent. I'm super pleased with it. My employees liked it as well. It went very smoothly. And we are currently working on employee reviews. So not one of my favorite things to do, but a necessary job nonetheless as an agency owner. And Kim is helping me navigate that and come up with something that is unique to our office and makes sense for us, because I think that's how the reviews really need to be done. So Kim, I can't thank you enough for joining us today, and I appreciate everybody being on board today. So thank you so much. Have a wonderful day.
Thank you. Bye-bye.
Bye-bye.